727. Let's head into the Zoom room where Senator Sabina Perez is sitting by. Good morning, Senator.
Good day. Good morning, Chris and Sabrina and KUM and everyone out there listening.
Good morning.
You know what? Thank you for choosing to spend your Friday morning with us. There's a lot of ways you can spend your Friday morning.
I know there's a session's coming up, so I have to get ready for that one as well. But there's always time for you guys, so yeah.
Yeah, day. Well, we watched with great interest yesterday, and I don't even mean that cynically, the public health budget hearing. It's a very interesting discussion there. What was your takeaway on that yesterday, Senator?
There's definitely stuff that was residual from last year regarding the budget, right? And I do, agree with the speaker that we don't want to be put in that same situation where the legislature has the perception of underfunding a health agency, right? And just to make it very clear that if they need that $13 million, they should put it in the budget rather than bank on funding which hasn't yet been solidified with the American Rescue Plan. So I do agree with the speaker on that, making that point strongly. I think there's when looking at the budgets, it's also interesting because Department of Public Health obviously has done it, has played a huge role during the pandemic. But just looking at how government is organized, I think we could do much better in regards to perhaps streamlining. And of course, this is probably easier said than done, right? Because a lot of these federal grants are very restrictive, and you have to follow it to a T. But I do hope that, being, our agencies, I hope that we can become more proactive in regards to, organizing the agencies a little bit more so that, it opens us up to more consolidation or collaboration with other agencies and dealing with issues that affect all of us, right? So, the one thing that, I see that some improvements could be made perhaps is in the planning process, planning of how to tackle issues with a more collaborative approach and how can we utilize funding. So kind of turning things around versus responding to a grant. Maybe we can think about an issue and how we can, as agencies, we can collaborate with each other and seek the grants that can support that effort, or utilize the grants that we have now and figure out how we can work within those frameworks. But that's definitely more of a long-term type of initiative.
Mm-hmm. Did public health say why they decided, to reduce, I guess, their general fund appropriation, that $17 million, and instead use the ARP money? I mean, it just didn't kind of make sense.
Yeah, it's kind of.
Did they kind of provide an explanation?
You know what? I didn't see one, and I was trying to look at the presentation that they had because it would have helped to have more of a breakdown of where that 17 million. I think they did, but as far as like what particular items they were looking at, I don't think I saw a clear explanation, but that's something to follow up with on why they requested 13 million. And I think too, somewhat, I guess in their defense as well, because all this money is coming through, right, through the federal government, it is important to kind of coordinate what we can use under their rules and how we can alleviate some of the budget requests. So if all of that money, that 13 million, is due to, let's say, COVID-related expenditures, one-time expenditures such as, equipment, I could see, protective gear, that sort of thing, services that would directly support the, response, the COVID response. I could see that if that's the case, then, I think that's fine. But if it's more that, yeah, I need to look more at the details.
Is it 13 or 17 million?
17.
Oh, is it 17? Okay. Yes, stand corrected.
Well, Senator, this is kind of like, to me, a preview of what you guys are going to probably come across as more agencies start to come in, is where you have this. It reminds me of the two antes. You know, when you go and you hit up your one auntie for, $20, and then you go and you hit up your other auntie who doesn't know that you got 20 from your first auntie, and then you get a 20 from her. So we got these agencies kind of going to Lou directly, the governor directly, and getting big chunks of this ARP funding or whatever, and then coming to you guys, and you guys are having to, you get stuck with having to reconcile, and it turns
Right.
into just a big. I mean, yesterday, out of half of the hearing, to me, it seemed like trying to just figure out this whole $17 million question.
Yeah, that's a good point. And, I do hope there's a little bit more planning behind that. I mean, we do hope that they are thinking about, being more leveraging the federal dollars and not having to. Yeah, they're not leaving any gaps when it comes to the local funding portion of it. And I think too, like if I can talk about another agency too, GWA, for instance. Here's an agency that is, they're looking to raise rates, and to go out to they need to borrow money to comply with the court ordered projects. And it is my hope that the money that comes from the American Rescue Plan or any kind of federal funding goes directly towards paying for these projects. And that's something that rather than increase the rates. So yes, I do hope there's a little bit more thought and planning, with these agencies. And you're right, you bring up a very good point. There has to be coordination amongst all the agencies and the governor's office to ensure that, we're utilizing these dollars effectively, and saving, saving the ratepayers, saving the taxpayers, basically helping the economy and the community.
What about your agencies under your oversight? Are we going to see? Have you already discussed? I'm pretty sure you have their budget plans, and then are we going to see something similar when, for example, Rev and Tax comes to the table, or DOL?
I haven't. We kind of developed the plan. I guess. So in some ways, I did talk to certain agencies like Guam EPA, GWA, Guam Solid Waste. I've been apprised of their financial needs. Department of Labor, they didn't put any request in, but we think that they definitely need support to carry out a lot of these initiatives.
What did you sorry? What did you make of Congressman Nicholas's press conference? I think he had it yesterday with Senator Moylan, and he was saying something about using the ARP funds to start up that unemployment insurance program. That's all I heard. I don't know anything else.
Yeah, that's. I think that might be. I think we have to balance all the needs, right? And unemployment insurance, as we saw, was very important during this pandemic. But we have to look and see how we can sustain something like that. Especially now that businesses are hurting, because eventually it's the businesses that are going to have to pay for this. So I would definitely exercise caution as far as using this money without having really thought through the long term and inviting all stakeholders to the table. So I think it's a little premature to really have a decisive answer on this without having more discussions and dialogue.
How about your thoughts on this cigarette stamp tax collection with the private company? It's a new law, and I know the director at Rev and Tax wasn't implementing it. There was they went to court, and so what's your take on that, and what's the status on that? I thought I saw something on it.
Yeah, so, well, first of all, there is a bill that I have introduced. It's Bill 104, and that would basically allow Department of Revenue and Taxation it would provide a funding source for them to carry out the program in-house. And whereas the law that was passed last year would privatize the collections of it at a much higher cost. So 12%, which is estimated to be worth about $5 million, versus the in-house projected costs about $300,000 to $400,000. And so right now, I believe there was a writ that was issued by the court to require DRT to comply with the law that was passed last year to privatize it, privatize the collections. And so I believe the Attorney General's office, they responded saying they are in compliance because they have started the procurement of the IFB. So basically the purchase of the stamps themselves. I believe they are working with DRT to, at least create the wording of the RFP itself. So that's what they're required to do. The law doesn't require them to award the RFP. So there's still an opportunity for DRT to implement the secret stamp tax in-house. And that's what my bill would do, and which is I hope to bring it on the floor during this session. But I did make changes with it. So initially it would require 1% fee from the wholesalers. And so the testimony that was given, the consensus by the wholesalers is, we don't want that, right? So it would have to come from the taxes that are collected. And I think, that this would definitely close a gap of the previous law where there was no source of funding, and it would also keep it in-house at a more reasonable cost. So that is that's my position is, let's implement it. I think nobody disagrees with that. It's important to have the secret stamp be implemented to increase compliance and enforcement of the law, as is required of the master settlement agreement, tobacco settlement agreement. So yes, but this would make sure that this would provide the funding source to do it in-house.
And that's the whole argument, is that DRT can do it for like 10 times cheaper than a private company. But what about the traction? Because this was one of these Vice Speaker Tina Munia Barnes, Mary Torres type of measures, which means that, at the outset, you're going to have, 4 or 5 people just straight up opposing this measure. So what's it looking like, your read of the room with the support of it?
Yeah, so I have my co-sponsors, including myself, and I think that I can get support for with the change of the bill. I think I can get more support for it. And of course, this is something that's contentious, very political issue, which is probably why it was never implemented too, as well. In addition to it being an unfunded, right? There's no funding source attached to it. But I think this is a fairer, this would be a much fairer route to go, because the company that does get, if GovGuam, and by the way, this would be the only jurisdiction in the whole United States that would have, if this is for the case, I don't believe there's any other jurisdiction that has privatized the enforcement of tobacco tax collection.
Yeah, I mean, it's a sweetheart deal for Wesco is what it sounds like. So
yeah, whichever company gets this is they have it made, right? If they're going to collect the millions that has been identified by a public auditor, at least not identified, but they've in their audit they said that you're possibly losing millions of dollars of collection. I mean, whichever company gets this deal has it made, and at the this money that could go towards Department of Public Health, that can go towards these other health agencies, Department of Education too. So I think it's a policy. Definitely, it's a policy decision. Whether the 36th Guam legislature wants to see, it not being privatized, right, versus continuing or allowing this enforcement of tobacco taxes to be privatized or not. So yeah, it's up for the body for decision.
I wanted to close it out here with the pause. Is that today?
You mean the registration, the public hearing that was held on Wednesday? Is that what you're?
Yeah, the pets thing. Sorry.
Yeah, I think it's important that, pets are registered, obviously. I think that's key to ensure that if your family pet is caught by these roundups, it's, they're safe. And I think that, yeah, there was some discussion in regards to, it's always been an issue of, I think, cost too, and implementing these programs. But then again, I know there's, whenever you increase any kind of fees, there's always issues with being able to afford these fees. But for me, I think registration is important as far as microchipping. And I think maybe perhaps I guess I'm of the position that if we can allow the owners to have more flexibility to have any identification, perhaps other identification of their pets. Yeah. So yeah, if there could be more flexibility with that, I think that should be fine.
Right on. Well, thank you for your time this morning, Senator.
Yeah, thanks, Chris.
Go get them. What are you most excited about in session coming up today?
Right now, what we have on the agenda, I think is, yeah, it doesn't look, well, I could be wrong, but it doesn't look too
crazy.
Too crazy, yeah. But I think there are several bills that are coming that might be more,
Yeah.
There might be more debate on it.
Well, there you go. Stay tuned, guys. Senator Sabina, thank you.
All right, thank you. Have a great day.
Okay, have a great Friday.